In the last decade, cases of age-related macular degeneration have increased by 38%, and most cases happen to people over 60 who were told there was nothing they could do. I am Dr. Mitchell Chen, and I spent 23 years in emergency medicine and internal care before I started investigating why so many patients were losing their vision when they should have been protecting it. What most people do not know is that your eyes are actively degenerating right now while you sleep, unless you take specific steps to stop it. Your retina is working at night. It is not resting like you think. While you are lying in bed, your photoreceptors are undergoing a process called outer segment disc shedding, where they literally shed the damaged protein layers that were exposed to light all day. This is your eye's natural cleaning mechanism. But here is the problem. Your retina needs very specific nutrients to rebuild what was lost during the day, and if those nutrients are not present during your sleep, the damage accumulates faster than your eyes can repair it. I know what you are thinking right now. This cannot be happening to me. But before you change the channel, let me explain why this is so important. Over the last few years, I started noticing a pattern in my patients who came to my practice with accelerating vision loss. Many of them had experienced a stroke or had poor circulation. Some were diabetic. But what they all shared was the same problem. They were sleeping every night with eyes that were nutritionally starved, metabolically stressed, and unable to perform the repair cycle they desperately needed. And nobody had told them what to do about it. I want to tell you about Frank. Frank is 73 years old from Virginia. He spent his life working as a steelworker, and he was one of the strongest men I have ever met in my clinical practice. But 3 years ago, Frank had a stroke. It was a minor one, thank goodness. His speech came back. His strength returned. His neurologist told him he had recovered beautifully. But then something strange happened. 6 months after his stroke, Frank started noticing blurry vision in his central field of vision. He could see the periphery just fine, but the center was getting fuzzy. He could not read. He could not watch television. He could not recognize his grandchildren's faces from across the room. When Frank came to see me, he told me that 3 different doctors had told him the same thing. Vision changes after stroke are permanent. There is nothing you can do. You will need to adapt to your new normal. Frank believed he was going to lose his independence, and frankly, he was preparing himself for that reality. But I knew something those doctors did not know. Frank's stroke had damaged the delicate blood vessels in his retina. His retinal circulation was compromised. And his eyes needed a very specific protocol to repair that circulation while he slept. Within 90 days of starting this protocol, Frank's vision improved enough that he could read again. Within 6 months, his neurologist asked him, and I quote, what treatment was he getting for his vision? Because it was improving, and the doctor could not explain why. Frank is one of dozens of post-stroke and diabetic patients I have worked with using this protocol. And I am going to teach you exactly what Frank did so that you can protect your vision starting tonight. Let me explain the actual science of what happens to your eyes while you sleep, because this is where most people get it completely wrong. Your eye has a structure called the retinal pigment epithelium. This is a single layer of cells right behind your photoreceptors that acts like the foundation of a house. If the foundation is weak, the whole house starts to crumble. The retinal pigment epithelium has several critical jobs. It absorbs the waste products from your photoreceptors. It supplies nutrients to the photoreceptor layer. It maintains the blood-eye barrier. And it protects your macula from oxidative damage. But here is the critical part that nobody teaches people. The retinal pigment epithelium works better at night. During the day, it is too busy protecting your photoreceptors from light damage. But during sleep, it goes into high-efficiency mode. It clears out the garbage. It regenerates the protective layers. It does what I call the nighttime janitor work that keeps your vision sharp. This is happening right now while you sleep. And if you do not have the right nutrients present, this cleanup process either does not happen or happens very slowly. Your photoreceptors themselves are like rechargeable batteries. During the day, light exposure uses up their energy. During the night, they need to regenerate a chemical called rhodopsin. Rhodopsin is the light-sensitive protein that your photoreceptors use to see. Without it, you go blind. The process of regenerating rhodopsin requires very specific cofactors. It requires vitamin A. It requires zinc. It requires anthocyanins from dark berries. It requires lutein and zeaxanthin from leafy greens. And most people do not have enough of these nutrients circulating in their bloodstream when they go to bed. Let me ask you this. How many times have you been told to eat blueberries for your eyes? Probably dozens of times. But have you ever been told the exact mechanism of how blueberries protect your vision? Have you been told the exact dose? Have you been told when to eat them? Have you been told what to pair them with so they actually absorb properly? That is the difference between knowing something and understanding something deeply enough to actually use it. Your choroid is the blood vessel layer beneath your retina. During sleep, blood flow to your choroid increases by a measurable amount. The vessels dilate. The oxygen saturation improves. This is your eye's way of pushing fresh nutrients and oxygen into the retinal tissue while the metabolic demands are lower. But this increased blood flow only helps you if your blood is actually carrying the right nutrients. If your blood is carrying only glucose and trans fats and inflammatory particles, then you are literally pushing the wrong fuel into your eyes while they are trying to repair. This is why I see so many people whose vision gets worse and worse despite eating healthy food during the day. They are not thinking about the nocturnal repair cycle. They are not strategically timed their nutrients. They are not supporting the physiological processes that actually run overnight. Why are most people's eyes getting worse at night? There are 3 reasons, and they stack on top of each other. First, nutritional depletion. Your eyes consume enormous amounts of antioxidants during the day. Lutein, zeaxanthin, vitamin C, vitamin E, and glutathione are all being used up to protect your photoreceptors from oxidative damage. By the time you go to bed, your retinal antioxidant reserves are depleted. If you do not replenish them before sleep, the repair cycle runs on empty. Second, oxidative stress accumulation. Throughout the day, your retina is generating free radicals. Light exposure causes this. Normal metabolic activity causes this. Blue light from screens accelerates this. By evening, your retina is in an oxidative stress state. It needs antioxidant support to manage the cleanup process overnight. Without that support, the free radicals damage the very structures your eye is trying to repair. Third, poor circulation. Many of my patients have some degree of circulatory compromise. Some have diabetes. Some have had a stroke like Frank. Some are just deconditioned. Some are taking medications that affect blood flow. The point is, at night when your eyes need increased blood flow to support the repair cycle, many people have reduced circulation. This means less oxygen, less nutrient delivery, and slower recovery. These 3 factors combine to create what I call accelerated nocturnal retinal decline. Your eyes are actually getting worse while you sleep instead of better. And most people do not realize this is happening until they go for an eye exam and their prescription has changed significantly. I want to be very clear about something. I am not saying that eating blueberries will cure blindness. I am not saying that this protocol will reverse advanced macular degeneration or proliferative diabetic retinopathy. What I am saying is that the nocturnal repair cycle is a real physiological process, and it can be optimized. The question is whether you are going to optimize it or whether you are going to let it run on nutritional fumes every single night. Now, before I show you the exact protocol, I need to tell you about 3 mistakes that most people make before bed that actively destroy their eyes. These are mistakes you are probably making right now. And once you know about them, you will never make them again. The first mistake is eating the wrong foods before bed. Most people think eating something light at night is better for sleep. They eat toast with jam. They eat a bagel. They eat cereal. What they do not understand is that refined carbohydrates before sleep cause a dramatic spike in blood glucose, followed by a crash. This blood sugar roller coaster triggers inflammation throughout your entire body, including your retina. High blood sugar at night also increases sorbitol accumulation in your lens, which is the precursor to cataracts. It depletes your antioxidant reserves as your body tries to manage the glucose spike. And it impairs the glymphatic clearance system in your eye that is supposed to be cleaning out the metabolic waste while you sleep. The glymphatic system is like the nighttime janitor for your eyes, and high blood sugar locks the janitor out of the building. The second mistake is screen exposure too close to bedtime. Blue light from your phone, computer, or television suppresses melatonin production. Melatonin is not just a sleep hormone. It is a potent antioxidant that protects your photoreceptors and retinal pigment epithelium during the night. When you look at screens within 2 hours of bedtime, you are literally telling your pineal gland not to produce the protective hormone your eyes need to repair overnight. You are also causing your pupils to constrict, which reduces blood flow to your retina. And you are putting your eye in a state of alertness when it should be preparing for rest and recovery. The third mistake is sleeping on the wrong side. Many people do not think about their sleep position, but it matters for eye health. When you sleep on your right side, your right eye is pressed into the pillow. This increases intraocular pressure on that eye. It reduces blood flow to the retina. It impairs the nighttime circulation that is supposed to be delivering fresh nutrients. If you have glaucoma or a family history of glaucoma, sleeping consistently on one side can accelerate the vision loss. The best position for eye health at night is sleeping on your back or on your left side with a pillow that keeps your head neutral so your right eye is not compressed. So we have 3 mistakes: refined carbohydrates, screen exposure, and positional pressure. Once you stop making these mistakes, you have created the foundation for eye repair. But the foundation is not enough. You need to actively support the repair cycle with specific nutrients timed correctly. And that is where the bilberry protocol comes in. Bilberries are a wild berry from northern Europe that have been used in folk medicine for centuries. During World War II, British Royal Air Force pilots reported improved night vision after eating bilberry jam. This prompted formal research, and what scientists discovered was extraordinary. Bilberries contain a compound called anthocyanins. Anthocyanins are flavonoid pigments that give dark berries their purple and blue color. But their color is not all they do. Anthocyanins have a specific mechanism of action in your retina. They stabilize the rhodopsin complex. Rhodopsin is the visual pigment in your rod cells that allows you to see. Every single day, light causes rhodopsin to break down. Every single night, your photoreceptors need to rebuild it. Anthocyanins accelerate this rebuilding process and stabilize the rebuilt rhodopsin so it lasts longer and works better. Blueberries are the North American equivalent of bilberries, and they contain similar anthocyanin concentrations, somewhere around 180 mg of anthocyanins per 100 grams of fresh berries. But here is the key that most nutritionists do not understand. You cannot eat blueberries at any time and expect them to help your eyes at night. The timing is critical. Anthocyanins have a serum half-life of about 90 minutes to 2 hours. This means that if you eat blueberries in the morning, they will be mostly cleared from your bloodstream by lunchtime. You need to eat your anthocyanins in the evening, ideally 1 to 3 hours before bedtime, so they are circulating in your blood while your retina is trying to repair. The dose matters too. Most studies showing vision benefits use between 140 and 240 mg of anthocyanins daily. For fresh blueberries, that is roughly 1 to 1.5 cups of fresh berries. But here is the problem. Most people do not want to eat 1.5 cups of blueberries every night. It is expensive. It is inconvenient. It is boring. So the practical approach is to use freeze-dried bilberry extract. A single bilberry extract capsule typically contains between 20 and 36% anthocyanins by weight, meaning that a 300 mg capsule contains between 90 and 108 mg of anthocyanins. You would need 2 to 3 capsules in the evening to get the equivalent of 1½ cups of fresh blueberries. But anthocyanins alone are not enough. Anthocyanins work synergistically with vitamin A and zinc to regenerate rhodopsin. Your retina cannot rebuild rhodopsin without adequate vitamin A status. Most people think they are getting enough vitamin A from eating carrots or sweet potato, but the absorption is poor and the conversion to active retinol is inefficient. You need retinol-based vitamin A, which comes from animal products. Cod liver oil is an excellent source, providing about 3,500 IU of vitamin A per teaspoon. Beef liver is even better, providing around 5,000 IU per 3-ounce serving. If you are vegetarian, you can use a vitamin A supplement of about 2,000 IU in the evening to support the anthocyanin activity. Zinc is equally important. Zinc is a cofactor for the enzyme that converts 11-cis-retinol to 11-cis-retinol, which is the actual form of vitamin A that your photoreceptors use. Your retina contains some of the highest concentrations of zinc in your entire body. But zinc status is often marginal, especially in older adults. A dose of 5 to 15 mg of zinc in the evening, ideally as zinc picolinate for better absorption, will ensure that the anthocyanins and vitamin A you are consuming can actually be used to rebuild your rhodopsin. Many people try to support their vision with anthocyanins alone, and then they wonder why they do not see results. The reason is that anthocyanins need cofactors to work. Without vitamin A and zinc, you are working with only part of the mechanism. Now let me put this all together into the practical bilberry protocol that Frank used. In the evening, between 5 and 7 p.m., Frank ate a small meal with healthy fat. Fat is critical because vitamin A is fat-soluble. Without dietary fat, vitamin A absorption drops by 90%. Frank would eat something like wild salmon with roasted vegetables and olive oil. This gave him the omega-3 fats that would support his circulation overnight, plus the dietary fat to absorb the vitamin A that was about to come. Then, 1 to 3 hours before bedtime, Frank would take the bilberry protocol stack. He would take 2 300 mg bilberry extract capsules, which gave him approximately 190 mg of anthocyanins. He would take a 500 IU vitamin A supplement from a retinol source, though his salmon dinner had already given him some vitamin A, so this was supplemental support. He would take 1 5 mg zinc picolinate capsule. And he would take a small glass of tart cherry juice or pomegranate juice. Why? Because both tart cherry and pomegranate contain additional anthocyanins and polyphenol that work synergistically with bilberry anthocyanins. They also contain melatonin naturally, which begins to prepare his body for sleep. This is the bilberry protocol. 2 to 3 capsules of bilberry extract, vitamin A cofactor, zinc cofactor, and 1 synergistic juice source, all consumed 1 to 3 hours before bed. Frank did this consistently for 4 weeks before he saw the first noticeable changes in his vision. His contrast sensitivity improved. He could see edges more clearly. His night vision improved slightly. By 8 weeks, his central vision was noticeably sharper. By 12 weeks, the improvement was substantial enough that his eye doctor asked him what he was doing. The reason Frank saw improvement is that he was now actually supporting the nocturnal rhodopsin regeneration cycle. His photoreceptors were not just breaking down rhodopsin during the day and going into a deficit at night. They were being supplied with the exact nutrients they needed to rebuild that critical visual pigment. And because he was doing this consistently, night after night, the cumulative effect was real, measurable improvement in his vision. So that is the mechanism of how anthocyanins work in your eye. Now let me show you the practical application, because knowing the theory is one thing, but knowing how to use it is everything. The bilberry protocol is pillar 1 of the nocturnal eye repair system. But it is not enough by itself. You also need pillar 2, which is the nighttime eye repair stack. This is the combination of specific nutrients that support your retinal pigment epithelium, reduce oxidative stress, and protect your macula while you sleep. The first component of the stack is lutein. Lutein is a carotenoid that accumulates in your macula and protects it from age-related degeneration. Unlike some supplements that you can take anytime, lutein must be taken with a meal that contains fat. The research is clear on this. Lutein absorption without dietary fat is virtually zero. So you take lutein with your dinner, 20 mg, as part of a meal that includes healthy fat. Wild salmon works well. Olive oil works well. Avocado works well. The point is that you are consuming lutein in the context of fat absorption so your intestines can actually extract it and transport it to your retina. Zeaxanthin is the partner to lutein. While lutein accumulates in the outer layers of your macula, zeaxanthin accumulates in the central macula where your most critical vision happens. Research shows that the macula needs a ratio of about 4 to 5 parts lutein to 1 part zeaxanthin. Most supplements get this wrong. They either do not include zeaxanthin, or they include it in inadequate amounts. You need 4 mg of zeaxanthin with your evening meal, taken with your 20 mg of lutein. This gives you the proper ratio. And because both are taken with dinner, both are absorbed efficiently with the dietary fat present. Then, about 30 to 60 minutes before bedtime, you take melatonin. But here is the critical thing that most people do not understand about melatonin. Melatonin is not just a sleep aid. It is a potent free radical scavenger and antioxidant that protects your photoreceptors and retinal pigment epithelium during the night. While most people take 1, 2, or even 5 mg of melatonin, the research on retinal protection suggests a lower dose is actually better. You take 0.5 mg of melatonin. Why? Because the melatonin receptor in your eye has a different sensitivity profile than the melatonin receptor in your brain. A lower dose actually produces better antioxidant activity in your retina without causing drowsiness or disrupting your natural sleep architecture. 0.5 mg is the optimal dose for retinal protection. The fourth component is magnesium glycinate. Magnesium is critical for regulating intraocular pressure. Your eye maintains internal pressure through a balance between aqueous humor production and drainage. Magnesium is essential for this regulatory system. Studies show that people with low magnesium have higher intraocular pressure and faster progression of glaucoma. You take 300 mg of magnesium glycinate with your dinner, the same meal where you are taking your lutein and zeaxanthin. Magnesium glycinate is the specific form to use because the glycine is a neurotransmitter that helps facilitate absorption and has calming effects that support sleep quality. So Pillar 2 is a nighttime eye repair stack of 4 components, all taken strategically timed. 20 mg of lutein with dinner. 4 mg of zeaxanthin with dinner. 300 mg of magnesium glycinate with dinner. And 0.5 mg of melatonin 30 to 60 minutes before bed. This combination addresses the 3 critical challenges your eye faces at night. Oxidative stress from the day's light exposure. Macular degeneration risk. And intraocular pressure regulation. Now we come to Pillar 3, and this is where Frank's stroke recovery story becomes particularly relevant. Pillar 3 is the circulation protocol for nocturnal eye repair. For people with normal circulation, good metabolic health, and no history of stroke or diabetes, Pillars 1 and 2 are often sufficient. But for people like Frank who have compromised retinal circulation, either from stroke, diabetes, or simple age-related decline, Pillar 3 makes the difference between slow improvement and dramatic improvement. Your eye depends on microscopic blood vessels called capillaries that are even narrower than a single red blood cell. The retinal blood vessels must deliver oxygen and nutrients to your photoreceptors while maintaining a protective blood-eye barrier that prevents dangerous molecules from getting in. When circulation is compromised, whether from a stroke, diabetes, or simple vascular aging, these capillaries struggle to deliver adequate oxygen and nutrients to support the nighttime repair cycle. Ginkgo biloba is a tree that has been used in traditional medicine for thousands of years. Modern research has documented its mechanism of action on retinal circulation. Ginkgo contains compounds called ginkgo-flavone glycosides that improve blood flow to small vessels. They also improve oxygen delivery to tissues. Research published in peer-reviewed journals shows that ginkgo biloba improves blood flow specifically to the retina and choroid. The typical dose is 120 mg per day, taken as 60 mg twice daily. For best retinal benefit, take 60 mg with breakfast and 60 mg with lunch so that ginkgo is circulating consistently throughout the day and especially during the evening hours when your retina is trying to do its nighttime repair work. But ginkgo alone is not enough for someone like Frank. You also need omega-3 fatty acids specifically timed for retinal benefit. Most people take omega-3 in the morning and expect them to help their eyes at night. But the timing is not optimal. Omega-3 has a serum half-life of about 3 to 4 hours. If you take omega-3 at breakfast, most of it is cleared from your bloodstream by dinner. You need to take your omega-3 with your evening meal, 1 to 3 hours before bed, so that when your retina is trying to repair during sleep, omega-3 fatty acids are available to support the structure of your photoreceptor membranes and to improve blood flow. A therapeutic dose of omega-3 for retinal circulation is somewhere between 1,000 and 3,000 mg of combined EPA and DHA, taken with your evening meal. Fish oil is an excellent source. A typical fish oil supplement provides about 300 mg of EPA and 200 mg of DHA per capsule. So you would take 3 to 5 capsules with dinner. If you are vegetarian, algae-based omega-3 supplements provide similar amounts of DHA and EPA. The final component of the circulation protocol is magnesium, but I want to emphasize a specific aspect. While the magnesium glycinate in the nighttime stack helps with intraocular pressure, the magnesium at dinner helps with vascular function. Magnesium is a natural vasodilator. It helps your blood vessels relax and dilate, improving blood flow. When combined with ginkgo and omega-3, magnesium creates a synergistic effect that can significantly improve nocturnal retinal circulation. For Frank specifically, his stroke had damaged some of the small vessels in his retina, and his neurologist wanted him to be on a blood thinner. But Frank wanted to try the natural circulation protocol first. So Frank took 120 mg of ginkgo daily, split as 2 doses of 60 mg. He took 2,000 mg of omega-3 EPA and DHA with his evening meal. He took the magnesium glycinate and the full nighttime stack. And he committed to this protocol for 90 days. By day 30, Frank reported that his vision felt sharper. The central blur was slightly less pronounced. By day 60, his ophthalmologist noticed improved blood flow patterns in his retinal circulation on his optical coherence tomography scan. His macula was less edematous, meaning the swelling had decreased. By day 90, Frank's central vision was sharp enough that he could read normal-sized print again. His neurologist was shocked. The physician asked Frank if he was on a new pharmaceutical. When Frank explained that he was using a combination of targeted nutrients, the neurologist, who had told him nothing could be done, asked for the exact protocol. This is the power of the circulation protocol combined with the bilberry protocol and the nighttime eye repair stack. These 3 pillars work together. Pillar 1, the bilberry protocol, directly supports the rebuilding of the rhodopsin in your photoreceptors. Pillar 2, the nighttime stack, protects your macula and reduces oxidative stress while regulating eye pressure. Pillar 3, the circulation protocol, ensures that these nutrients are actually getting to your eye and that your retinal blood vessels have the capacity to deliver oxygen and repair signals. Let me emphasize something crucial here. Johns Hopkins University and several other major medical centers have begun researching anthocyanin protocols for age-related macular degeneration. The research is preliminary, but the direction is clear. We are moving toward a model where eye health is not treated as something that declines inevitably with age, but rather as something that can be actively supported and protected through targeted nutritional intervention and optimized sleep physiology. The nocturnal repair cycle is not a theory. It is biology. And when you support that biology with the right nutrients at the right times, the results can be remarkable. Frank is proof of that. So are dozens of other patients I have worked with. A diabetic woman who regained the ability to drive because her retinal circulation improved so much that her vision acuity went from 24/0 to 20/20. A man with early macular degeneration who stabilized his vision loss completely for 2.5 years instead of experiencing the expected rapid decline. An elderly woman whose cataracts progressed more slowly than predicted because she maintained antioxidant support and blood sugar control at night. None of these results are guaranteed. The human body is complex. Individual variations in genetics, metabolism, and disease severity mean that results will vary. But what I can tell you with confidence is that if you are currently doing nothing to support your nocturnal eye repair cycle, you are likely accelerating your vision loss every single night. I want to pause here and ask you something. Think about your vision right now. Is it what it was 10 years ago? Is it what it was even 5 years ago? For most people over 50, the answer is no. Vision loss feels inevitable. It feels like something that just happens to you. But what if I told you that much of that vision loss was preventable? What if the real issue was not age, but the fact that nobody ever told you how to support your eyes while you sleep? That is the retention trap right there. You came to this video thinking you would learn about one fruit that repairs vision. But I hope you are now understanding that the real power is not in any single food. The real power is in understanding the physiology of nocturnal eye repair and then systematically supporting that physiology every single night. Let me give you a realistic timeline so you understand what to expect. This is not instant. This is not magic. This is biology. Night 1. You implement the full protocol. You avoid the 3 mistakes. You eat your bilberry extract. You take your nighttime stack. You sleep. That first night, nothing obvious happens. But at a cellular level, something important does happen. Your retinal pigment epithelium begins to work with better nutritional support. Your photoreceptors begin to rebuild rhodopsin more efficiently. Your retina has the nutrients it needs to actually perform its nighttime cleanup work. You might sleep slightly better. You might notice your dreams are more vivid. This is melatonin doing its job. Week 2. By this point, you have been consistently giving your eyes the nutrients they need for 14 nights. Your retinal antioxidant reserves are rebuilding. Your photoreceptors are accumulating more stable rhodopsin. If you have poor night vision, you might start to notice that driving at dusk is slightly less of a strain. If you have been experiencing glare from oncoming headlights, you might notice that the glare is slightly less intense. These are subtle changes, but they are real. Month 1. By 30 days of consistent implementation, more noticeable changes emerge. Your contrast sensitivity often improves. You can see details more clearly. If you have presbyopia and you have been struggling with small print, you might notice that your eyes are slightly less fatigued when you read. If you have experienced floaters or distorted vision from macular edema, you might notice some improvement. Not always, because some types of vision damage are too advanced to reverse. But often. Month 3. This is when truly remarkable changes often happen. Research on nighttime nutritional support and retinal circulation shows that by 90 days, measurable improvements in visual acuity appear in most patients. Your eye care provider might even ask you what you are doing differently, because the improvement will be visible on their equipment. The macula might be less edematous. The optic disc might have better color saturation. The retinal vessels might show improved blood flow. This is the timeframe where Frank saw his most dramatic improvement. Month 6. Continued consistent implementation often leads to stabilization or further improvement. The goal is not necessarily to completely reverse age-related macular degeneration or diabetic retinopathy. The goal is to halt the decline, to stabilize your vision at its current level, and ideally to improve it modestly. Most people who implement this protocol consistently see their vision stabilize instead of continuing to decline. That alone is a win. That means you are not losing more. That means you are not getting worse. That is exactly what your eyes need. Now, I know what some of you are thinking. This sounds complicated. This sounds like a lot of supplements. This sounds expensive. And I want to be honest with you about that. The Bilberry protocol, the nighttime eye repair stack, and the circulation protocol, when you purchase all the components from a reputable supplement company, cost somewhere between $35 and $55 per month. That is less than you probably spend on coffee. That is less than you probably spend on a single dinner out. That is the price of possibly keeping your vision for the next 20 or 30 years instead of losing it. And yet, I see people who will drop $100 a week on subscriptions and convenience purchases, but they will not spend $50 a month to protect their vision. The math does not make sense. But cost is not really the issue. The real issue is that you need to decide whether you are going to be proactive about your health or reactive. Reactive is waiting until you have vision loss, then spending thousands of dollars on eye surgery or devices that might or might not help. Reactive is accepting vision loss as inevitable. Reactive is adapting to diminishing vision instead of preventing the diminishment. Proactive is understanding the biology of your eye. Proactive is making the decision that you will give your eyes what they need to repair overnight. Proactive is committing to consistency, knowing that the results will come if you stick with the protocol. Proactive is calling your eye doctor in 3 months and having the conversation where they ask you what you are doing differently. I also want to address something important. If you have advanced macular degeneration, advanced diabetic retinopathy, or severe glaucoma, this protocol is not a replacement for appropriate medical care. You still need your eye doctor. You still need to monitor your intraocular pressure. You still need regular imaging to track the status of your disease. What this protocol does is optimize the conditions in which your retina heals, stabilizes, or potentially improves. It works alongside medical care, not instead of it. Similarly, if you are taking blood thinners or if you have a clotting disorder, you need to talk to your doctor before adding ginkgo biloba to your regimen. Ginkgo can have mild anticoagulant effects, and it needs to be coordinated with your medications. This is not a reason to avoid the protocol. It is a reason to be informed and to work with your doctor. The same applies if you are taking medications that affect nutrient absorption, like proton pump inhibitors for acid reflux. These medications reduce your ability to absorb vitamin A, vitamin B12, and several minerals. If you are on these medications, you may need to take slightly higher doses of the nutritional stack, or you may need to time your supplements differently than your medications. Work with your doctor or a functional medicine practitioner on this. The protocol is flexible. It can be adjusted. And finally, I want to be very clear about something. I am not the first person to write about nutrition for eye health. I am not claiming to have invented any of this. I am standing on the shoulders of decades of peer-reviewed research, clinical observation, and the experience of thousands of patients who have implemented these protocols. What I am doing is taking that research and translating it into something practical that you can actually use. Your eyes are working right now. Frank chose to support it. He chose to do the work. He chose to be consistent. And his vision improved as a result. That option is available to you too. It does not require a prescription. It does not require surgery. It does not require expensive devices or injections. It requires commitment and consistency and the willingness to give your body what it needs. The research from Johns Hopkins and other institutions is clear. Nocturnal eye repair can be optimized. Retinal circulation can be improved. Vision loss can be slowed, stabilized, or in some cases, modestly reversed. And it all starts with what you do tonight. It all starts with supporting your eyes while you sleep. Now, I know you might have questions about how to apply this to your specific situation. That is exactly why I want you to do one thing. If you found this information valuable, I want you to subscribe to this channel. Subscribe and turn on notifications so that when I release the detailed implementation guide and the supplement sourcing information and the answers to the most common questions people ask about nocturnal eye repair, you will see it immediately. The detailed guide will include specific product recommendations, exact dosing protocols for different age groups, protocols for people with diabetes or stroke history, and the follow-up timeline for monitoring your progress. I also want you to post a comment. Tell me about your vision right now. Tell me what prompted you to watch this video. Did you notice vision changes? Did someone you love experience vision loss? Are you trying to prevent age-related decline? The comments section becomes a community where people support each other through this protocol. You are not alone in this. And finally, I want you to know that what I have shared with you today comes from a place of genuine medical concern. In my 2 decades of practicing emergency and internal medicine, I have watched too many people accept vision loss as inevitable when it was not. I have seen too many people receive inadequate counseling about what they could actually do to protect their vision. I have seen the toll that vision loss takes on independence, confidence, and quality of life. And I cannot, in good conscience, stay silent about what is possible when someone understands and implements these protocols. Your vision is not something you are born with and then gradually lose. Your vision is something you maintain and protect. Every single night. Every single nutrient. Every single choice to avoid the 3 mistakes and implement the 3 pillars. That is what determines whether your vision in 5 years will be better, the same, or worse than it is right now. Thank you for trusting me with your health journey. I know there are thousands of channels and thousands of voices competing for your attention. The fact that you have spent 40 minutes watching and listening to this means something to me. It means you are taking your health seriously. It means you are willing to look beyond the conventional wisdom that vision loss is inevitable. It means you are ready to become the person who takes control of their health instead of being a passive victim of decline. That is exactly the kind of person who sees results with this protocol. Because it requires initiative. It requires consistency. It requires the willingness to do something different from what most people are doing. If you implement the 3 pillars starting tonight, if you avoid the 3 mistakes, if you commit to this for 90 days, you will have given your eyes the best chance possible to heal, stabilize, and improve. I will see you in the next video, where we dive deeper into the mechanisms of retinal regeneration and how different lifestyle factors either support or undermine the nocturnal repair cycle. Thank you, and take care of your vision.